So
Great.
first of all,
Thank you. Thank you very much indeed. And welcome to the second day of MedInfo 21, One World, One Health Global Partnership for Digital Health. It gives me great pleasure to open the second day of the conference, which will have a number of live sessions, and of course, the recorded sessions of the technical papers are available. And as my colleague, Dr. Paula said, please refer to the program to get the full information. Yesterday was again a fantastic day in terms of the presentations, in terms of the panel sessions, and in terms of the Grammy Award that was awarded to Dr. Shortlip. And in their presentations and in their talk, they did actually emphasize a number of things that the community that is dealing with medical informatics or e-health or digital informatics were reminded of, including don't forget the patient as the center for this whole thing. Integration was another idea that was mentioned a number of times and overemphasized. The interoperability was a big issue that that brings people together, and systems and all that. The cost effectiveness of the interventions was also a topic that was clearly mentioned by the different speakers. We were very thrilled to hear our friend Professor Shortlip for the history that he provided for taking up the medical informatics as a science. So today we have another day of presentations and talks and discussions, and we hope it will be up to the expectations in terms of the usefulness and in terms of the relevance to what people are trying to achieve. And the start of all this, actually, we will have Dr. Paula Otero. She is the co-chair of the SPC for the conference, and Dr. Philippe Scott, he is the co-chair of the SPC, and they both actually will bring together a session that is about the best student paper awards. They will tell you all about the numbers and the issues and the process by which they made the selection. One word from me to say that students of today are the professionals of tomorrow, and we have great expectations that they will meet these expectations, and they will be excellent in their endeavor to take up the medical informatics, health informatics, digital health into the future. The students are from all over the world, of course, and I leave that to Dr. Paula Otero and Dr. Philippe Scott to talk about all that and give the award to the best student paper, and of course the other students who provided excellent contributions to the work of this conference. Dr. Paula and Dr. Scott.
Thank you, Najib. For us, it was a great honor for me and Philip to participate as SPCs, as chairs of SPC. I guess it was a great challenge because we were used to the MedInfo in person, but the review process of the papers was quite a lot of work, and it was really hard to select the papers from the students. So can we see the next slide, please, Philip? We had a total of 324 presentations from MedInfo, and that was a very good number, taking into account all what has happened through the pandemic all throughout this year. A total of 59 student papers were accepted. Next, please. So we need to recognize those students that work really hard based on the reviewers and the score they gave them, and the final review we did with the track chairs and also with Philip and myself. So now to you, Philip.
Thank you, Paula. So we come first of all to the third prize, and I'm very pleased to tell you that the winner of the third prize was Yanni Chen from the College of Biomedical Engineering and Instrument Science. Zhejiang University in Hangzhou, Zhejiang province in China. And the paper was entitled "A Semi-Automatic Data Cleaning and Coding Tool for Chinese Clinical Data Standardization." So that's one to look out for in the proceedings and in the recorded presentations, and a particular challenge, I think, in using the Chinese language and the mappings required for data standardization there. So well done to Yanni Chen. So moving on to the second prize, Paula.
Yes, the second prize was for Alice Roger from the Centre de Recherche de Cordeliers de l'Université Sorbonne de Paris-Cité in France. The title of the paper was "Using an Ontological Representation on Chemotherapy Toxicities for Guiding Information Extraction and Integration from EHRs." We know that a knowledge representation is quite a big work and is one of the aims that health informatics is working on. So this paper was awarded because of that. Philip?
Thank you, Paula. So now we come to the first prize, the gold medal paper for student papers MedInfo 2021. And I'm very pleased to say that the winner is Georgina Kennedy from the Centre for Big Data Research in Health at the University of New South Wales, Sydney in Australia. And her paper was entitled "Augmentation of Electronic Medical Record Data for Deep Learning." So well done to Georgina for winning the best paper for students' papers this year. That's great to see. And I think it's worth saying, in conclusion, we want to congratulate all of our winners, and we will be sending you official IMEA certificates following the conclusion of the conference. But we also want to say well done to all the students who had papers accepted into the programme. Just like the rest of us, students were working under unusual pressure this year. So to be able to get a paper together and submitted and accepted after peer review is in itself a great achievement. So don't be disheartened if you didn't win a prize this year. There was, as Paula said, such competition and only 3 prizes. So, you know, submit again when the next conference comes around, whether it's the next MedInfo in Australia, but hopefully before that, there will be local regional IMEA conferences such as the FME MIE conference that we have in Europe, and no doubt you have similar things wherever you live. So we'd like to say very well done. And just a closing comment, I'd like to pick up on what Najib said, that, you know, we're talking here about the next generation of health informatics leaders. And so to see the very good quality of work that's been submitted is very encouraging. And we really hope that you'll keep going and persist in the field and contribute to the leadership of the movement as we go forward. Paula, anything you'd like to add in closing?
No, thank you very much. It was a really, as Philip said, it was really hard. But we are really proud that we have 59 students' papers that were accepted. So I guess that Najib can continue with the session.
Thank you.
Thank you. Thank you very much indeed. I just want to add my congratulations to the winners of the prizes, and of course to the 59 people who have submitted successful papers. And I can assure you that all papers meet excellence, and they are really, really good quality. But the team had to choose the best 3. So congratulations to everybody. And I do look forward actually to seeing the new generations taking over and excelling in the future. Now it's time for me to welcome my 3 panelists. I'm not sure actually if Samir is around, and because he was a little bit late for some reason. But it is actually a pleasure to welcome the 3 panelists, Mr. Marcello Agostino and Dr. Mordek Chipi, and of course, Mr. Samir Bojiro, who will join very soon, and I hope so, at least. I don't want to waste a lot of time actually to introduce these 3 people, because at least for 2 of them, I know them very, very, very well. And my words on them will be a little bit biased because I know them very well. especially Marcelo Agostino. We worked together for many years, and you can see from his beard how he looks a little bit old, and but he's young. He's young. No problem for that. So Marcelo is actually the senior advisor for information systems and digital health at the Department of Evidence and Intelligence for Action in Health in the Pan American Health Organization, PAHO, which is the regional office of WHO in the North and South America. And it's a big office, and I do remember actually being there a number of times and working with Marcelo on a number of issues. Marcelo is very well known for his commitment to digital health and the use of information and communication technology for health. I'm not sure if he wants to add more actually, but that will be on the expense of his own time in presentation and talking. The other person, to me, he is new, Dr. Chipi, and he is the regional advisor for innovation at the World Health Organization Regional Office of Africa in Brazzaville in Congo. And I would like to welcome him to the team #1 and to WHO #2, and of course to this session #3. Dr. Chibi works for the World Health Organization Regional Office for Africa as the regional advisor, and his role is the coordination and implementation of the transformation agenda that has been developed actually for that. And of course, he is most welcome. He is from South Africa, and he has more than 15 years of experience in research, development, and innovation in the health sector. And I don't want to mention anything about my friend Samir before he arrives, and as soon as he arrives, we will make sure to introduce him properly. So I have the pleasure to introduce and to ask my friend Marcelo to present to make his presentation, and then if there are any comments, please do write in the chat, and we will make sure to pose them to Marcelo and to Dr. Chibi. I really look forward to what you have been doing. I used to work for WHO, but I retired, a number of years ago. And it's always great to see new generations and people coming and going, enriching the organization and working very hard to make the benefit to the countries and to the people that the organization is supposed to help. So Marcelo, would you like to start?
Yeah, thank you. Thank you very much, Najib. It's a real pleasure to be here with you again after several years of collaboration, and also very happy to be with my good colleague and friend Moredrik. We almost chat every week now. And thank you, Paula, also, because we worked together for several years also. So very happy to be here. And if you, it's okay for you, Najib, I will start sharing my screen. I have a presentation here. Can you see my screen? I assume yes, right?
Yes, we can. I can see it.
Yeah. Okay, perfect. So I will start with the presentation, and first of all, congratulations to the winners, and I'm very happy to hear this repetition of new generations, because I think that this is what is needed on the digital age, or as the Secretary General of the UN called, the age of digital interdependence. No, so very happy to have new generations on board. I will speak on how was the roadmap for the digital transformation of the health sector in the Americas, and also including the evolution that started some time ago. So my presentation has 4 main, let's say, areas. Where are we now? How did we get here? A regional maturity assessment, because we conducted a maturity assessment in standardized ways across 49 countries and territories of the Americas, are the one who work with us. We work with all the countries and territories. And some reflections, and that part is the one that I would really like to hear also from the audience. So where are we now is This is the last step that was approved, and I don't know if the audience is familiar. In PAHO and WHO, we go with resolutions and mandate. They are documents, policy documents that are requested and approved and endorsed by what we call member states, that are the countries that are part of our network of work. In our case, are the countries of the Americas, and our director used to say are our bosses. So with them, we discussed last week in the PAHO's Directing Council is a meeting with all the ministers of health of the America, plus partners, and we approved a policy document to establish a roadmap for the digital transformation of the health sector in the region of the Americas. And this is key because this is now an official document that all the countries agreed to follow, including partners. So we are having a very strong partnership with the Inter-American Development Bank and now with UNICEF. We have financial and technical support from USAID, the government of Canada, Spain, and many other partners and foundations. So that's a mandate that we have for the Americas. And this policy document is based on 8 guiding principles for digital transformation that we have developed with the countries of the Americas. And those principles are not something that we created on the vacuum. These are just the evolution and the customization of the roadmap defined by the UN Secretary General, Antonio Gutierrez, for the digital cooperation at the age of digital interdependence. That was an external group created by the Secretary General, was led by Melinda Gates, and they defined 8 lines of action. So we did an analysis with our countries, and we discussed that the regional roadmap now, and in particular, after all the lessons that we got from the pandemic, we need to work in these 8 strategic lines. So we started with the guiding principle, but then we transformed those principles into official strategic line of actions. And those principles are universal connectivity. We want to ensure universal connectivity in the health sector by 2030. Digital public goods, with the idea of the co-creation of digital public goods, to reduce also digital device, gaps, etc. And this is connected with the principle number 3, that is having an inclusive digital health. If we look at numbers, just in the Americas, we have more than 250 million of people without any kind of connectivity. What that means is that this mandate of staying at home is not possible for 250 million of people. So this is why we believe, and we put that together with the countries, issues like connectivity, bandwidth, and inclusive digital health should be part of some kind of new determinants of health. Then, of course, and I'm happy to hear the summary provided by Najib about interoperability. This is still a priority, but also it's still a pending issue. We have several years talking about interoperability, so we need to find a way to accelerate actions there. Then, of course, we believe, and this is part of the strategic lines of action, to mainstream the human rights in all the areas of digital transformation, so everybody can have access to health. So that this is a discussion that we are having, not only with the health sector, but with legislators, with bioethicists, with other groups, in order to achieve that principle number 5. Then we are dedicated one specific strategic line to artificial intelligence. In addition to the, let's say, technological side of artificial intelligence, is how to position countries and institutions to participate in global cooperation. And this is a huge issue that countries are facing today, in particular to ensure a more equitable approach and open approach to the use of artificial intelligence in public health. Of course, information security This is a huge issue and should be at the top level of any public health agenda today. There are a lot of concerns related to information security and cybersecurity, but also issues related to privacy, confidentiality, etc., that is around open data sets, everything digitalized, etc. And finally, we believe, and this is part of the policy, that we need to start discussing this concept of a new public health architecture in the age of digital interdependence. So this is where are we now. We translated the guiding principles into a policy document that was approved and endorsed by all the countries and territories in the Americas. But if we go 5 years ago, because this is not a document that started one day from the scratch. So this is the process. We started, our director, Dr. Carissa Etienne, challenged us and called for a discussion with ministers in 2016 to have a renewed vision for the Americas on information systems for health. Then together with the countries, always looking at the experts and working with partners, we develop a conceptual framework and a technical framework and tools. And one of the most important tools was a maturity assessment tool that was organized based on this conceptual and technical framework. Basically, we look at countries from the point of view of data management and governance, information technologies, information and knowledge management, and innovation. So we apply that tool across the Americas. In 2019, we passed a plan of action that was also approved and endorsed by all governments in the Americas, a plan of action for the strengthening of information systems and digital health. And in the middle of that, and during those 3 years, we developed several on-site visits with partners, with experts, deploying people. We cover 21 countries plus almost all of them with virtual mechanisms. So with that, we have a very holistic approach of the Americas. But together with that, because we are always focused on country needs, we want to start always with discussions from countries. We don't want to impose any kind of tool, standard, or concept if we are not fully aligned with the real needs of the countries. And I always say that, and in particular now if we have new generations, I always share one, for me, life experience, because I was in one country trying to, in a way, to impose some technical concepts and arguments. And after 1 hour of speech and presentations with a lot of interesting topics, when we asked the question to the head of a primary health facility about needs, she told us, my priority now is to have a printer and a scanner, because I am not complying with the law. I need to sign the papers where I have my medical records. This is my priority now. Then I will have time to discuss everything that you comment in your presentation. And this, I know, is a simple example, but this is something that we need to consider for the new generations in particular. We need to look at the country needs and the real needs of the population, the real needs of the governments, and based on that is where we need to develop tools, trainings, etc. So based on all of that, we conducted an after-action review in 2021 with all the countries and territories and partners to capture lessons learned from the implementation of the Information System for Health Plan of Action. With that, we developed the 8 guiding principles, and then we transformed the guiding principles into the policy documents. So that was the evolution, 5 years of work with the countries. I will not go into particular details here, but as you can see, the key point of this slide, this is the result of the assessment in the 49 countries and territories. We are not putting names because we don't want to compare. This is not the intention of the maturity assessment. The intention is to find common problems and common solutions. But if you look at, if we go, for example, on the first one, the subregion number 1 is 4.3, the level of maturity, 5 is the maximum, but you still see that we have regions, sub-regions that are at level 1. So there is a lot of inequalities in regards to data management and information technology, and we cover also data sources, information products, everything related to IT infrastructure, standards for quality and interoperability. On managerial management and governance issues, you see the same thing. There are regions that are very well advanced, but you can see that there are regions that are struggling with a lot of challenges. And this is our role. And this is why we develop regional policies, because we want to have common solutions that can be applied to all the countries, no exception. So we did an analysis on financial and human resources, leadership and coordination, policies, legislations, organizational structures, etc. The same thing we did with the knowledge management and sharing. We have more than 100 indicators and questions because we wanted to see the level of engagement of the academia, scientific community, international expert, the concept of knowledge architecture, knowledge processes, networks, social participation, and strategic communications. And then finally, we put a layer of analysis with the lens of innovation that mainly was something that is very clear today with the pandemic, but we did that almost 3 years ago, is how to position the health sector within the e-government initiative, because this is a big lesson for the health sector. We normally discuss or decide on standards, on issues related to infrastructure, on training, etc., related to the digital world. However, normally e-government initiatives are part of the head of state's office, presidencies, vice presidencies, and they are the one who are looking at standards for all the sectors. So we need to find a way on how to connect the health sector and decisions within the e-government initiative. That was part of this discussion when we did the analysis on innovation. So based on all of that, I want to share some reflection. We work a lot, and as Najib mentioned, we work for years and years with partners, countries per se, etc. But how did the pandemic catch up as in regards to digitally prepared? So as you can see, there were a lot of challenges related with lack of solid foundations from the conceptual or technical frameworks, digital literacy issues, so human resources were not well prepared for this massive adoption of new technologies. In 24 hours, countries received proposals for magical solutions, apps, 1,000 chatbots, applications, AI-based solutions, etc. So everybody was not very well prepared. At least the region of the Americas, there was a lack of understanding also about the, let's say, a safe, ethical, and under legal framework adoption of telemedicine. In some countries, we have legislation. In some other countries, we don't. In some other countries, we are working with legislators to renew the legislations. So it's still a challenge, although it was one of the main approaches used during the pandemic, in particular when related to the continuity of care. There was also another layer of complexity, the management of critical data, because traditionally we work in basic indicators, the common elements or the common data that is being captured by countries, but suddenly there was a request for particular data that was not very well organized by the countries. And of course, the IT infrastructure, in particular, all the challenges related to bandwidth and connectivity. So this is what we did. I will not go into those details, but we immediately start working with partners, as I mentioned before, with collaborating centers, in particular with the Hospital Italiano from Buenos Aires, and through Paula, I want to thank also the entire team there that is being led by Dr. Daniel Luna. So we developed guiding principles, policies. We conducted a series of webinars, lectures. We developed knowledge capsules to provide the key knowledge that was needed in one particular concept in the right time and in the right format. Some guidance related to interoperability, tools for assessing issues related with telemedicine that we call telemedicine readiness assessment tool. We developed also a particular tool for the rapid assessment for critical data gathering. And of course, we are supporting in another layer of technical details with the Go Data and other platforms for in some countries in where they don't have an IT platform for data collection. But as was mentioned several times in several conferences, there is a huge opportunity here that we need to take advantage. So we cannot ignore this issue because we can improve issues related with standardization and tools, networking and collaboration, human resources. We also have an opportunity to finally tackle the infodemic, not only when related to the pandemic or the anti-vaccines group, but also we can create some tools and methodologies for managing future situations. In PAHO, we are running a proof of concept for the implementation of what we call an anti-infodemic virtual center. And of course, we can have new conceptual frameworks, and we have the ability, we have all the elements today that are needed to renew old policies. So some reflections that our director mentioned in our, what we call the Information System for Health conference when we did the after action review. Basically, we need to connect the disconnected. We all need to embrace the concept of an inclusive digital health. We also believe that we need to invest more and more and in a holistic way on digital literacy and education. We cannot separate the discussion between digital health and data management because we are convinced that data save lives. So we need to find a way to have the same discussion at the time that we discuss, for example, medical record platform. We need to be thinking also on the data that will be used for policy and decision making at different levels. And also we believe that we need to have a more, what we call an open public health, because we more than ever need open data, open source solutions, open algorithms, open science, open everything as much as possible, of course, with under very rigid ethical frameworks and considerations of privacy and confidentiality. So just a final thought, what does the future hold? We believe that without a doubt, that will be a digitally interconnected society. I don't know if you follow the UN General Assembly also 2 weeks ago in the inaugurational speech from the Secretary General, but also several presidents, including the US president, mentioned this particular topic, that we are living in a digitally interconnected society. That means that we need to have a digitally interconnected public health. And that means that, and I am very happy to have my colleagues from Africa and all of you here, because networking and collaboration, we believe, must go from being just an option to being an obligation. So with that, I will stop my presentation, but I want to thank especially to all the partners, but in particular USAID, the Spanish agency also for International Cooperation, IC, the Inter-American Development Bank, the Government of Canada, and the Hospital Italiano from Buenos Aires. So thank you very much, Najib. I stop sharing my screen now.
Thank you very much indeed, Marcelo. And I think the interconnected world is actually the motto that we are adopting in EMEA, which means actually all the world is seen as one through the networking and through the digital features, the digital economy, connectivity, and all that. So please have your questions ready so that you can ask Marcelo and other people on the topics that you are interested in. And since Samir is with us, he has just joined, I would like to welcome him. Samir, are you here?
Yes, I'm here, Dr. Najib. Can you?
Excellent. Great to see you. Great to see you, Samir.
Likewise, apologies.
You were a little bit late by a few minutes, but nevertheless, you are here. So most welcome. Samir Boujari is actually a WHO headquarters staff, and he is in charge of a number of things at the headquarters in Geneva, including the global digital health strategy. So what we expect from Samir is to tell us a little bit more about the strategy and its action plan, and more important is how that actually is reflected on the different regions of WHO. Samir is very well known actually in WHO. We did work together, although he was in another department, but nevertheless, the Be Healthy, Be Mobile initiative, which was created by that particular cluster, was closely related to my department, and I did participate actually in their governing body and meetings and all that. I don't want to say more about Samir because his reputation as an excellent colleague and excellent UN staff is actually in front of him. So without any further to do, I would just like to welcome Samir for the session and ask him to spend the coming maybe 10, 15, 20 minutes talking about the global digital health strategy and how it has been reflected on the development of national and regional strategies in the different regions of the world. Samir, the floor is yours. Go ahead.
Thank you so much, Dr. Najib, and thanks for the very kind words. It's always been a pleasure to learn and work with mentors like you. So as Dr. Najib mentioned, and also as my dear friend Marcelo has already presented the work in the region, what I'll do is give you a bit of foresight on the global strategy of digital health, where it has come from, where it aims to go from here. I'll try to share my screen. Please do let me know if you can see the slides. And so I can then, can someone please confirm if you're able to see my slides?
We can see,
yes,
I can see them.
Yes.
Okay, perfect. Thank you so much. I'll put it on the presentation more than in that case. So the first, I mean, just as Dr. Najib mentioned, I've been at WHO for almost 14 years in Geneva here, working in different areas of digital health all throughout. Before that, I've been in the field for a long time. And the key of this digital agenda was that we have, countries have been very distributed in implementation of digital health. They've been very, I mean, as we have always heard, the pilotitis agenda, where we have a lot of evidence going out, and there was no mechanism where it was governed by in a systematic way. And so that's where what led to the thinking about this global strategy of how it was made and converted. This is not a new thing. It has been on digital health, e-health under the era of Dr. Najib, has been on at WHO for a long time, and it has evolved rapidly as the technology has evolved. And now we are really at the cusp of where we want to see it grow. As our Director General always says, he's very passionate about digital health and made this transformation happen. He says today's digital health is tomorrow's health. And that's where we are trying to take WHO towards, to be able to help countries present that vision of tomorrow's health as digitally equipped ecosystem environment spaces. In 2018, the member states passed the resolution on digital health, which was a milestone in terms of bringing digital to the forefront. I mean, as everyone has showcased, there's been a lot of efforts, but it has come together through this digital agenda in 2018. And following that, the global strategy of digital health was then created by member states and uniquely sort of endorsed by all member states in November last year. So it has been a big action. Now, what is the global strategy on digital health? As I mentioned previously, it's a simple process where we're trying to make digital health as an enabler for healthcare services across the planet. Trying to maximize the outreach, take the ubiquity of technology, take the ubiquity of solutions, take the ubiquity of the power of computing, and enable health services in any ways that we can at the ground level to meet the needs of every country as it fits into that. Of course, the strategy has been created by member states, so it's not a WHO only strategy. So there's a commitment that everyone will be working towards the strategy. So from the national systems perspective, from existing.
Samir, can I just interrupt you for 1 second? Can you change the way that you are presenting so that the full screen can be seen? It's seen as actually on your computer with the small one and the big one, which actually drives.
Thanks for pointing it out. Let me try to switch it. I am seeing a full screen, but clearly it's not working out like that. So
okay, now if you put it on the full screen, the one up. No. Go back to the situation that you were. Yes, and then go to full presentation. Yes, indeed. Now it's your picture showing, but we would like to see the presentation itself.
Yeah,
of course, we would like to see you.
Please let me know when you see it.
No, that's fine. Except that, yes. Go up.
Yeah, I'm trying to go to full screen more, and there you go.
To the slideshow.
Is that okay now?
Slideshow.
Yeah,
it's fine. It's fine.
You see it now?
Yeah, we can see. See. I'm sorry.
No, it's okay. Thanks for pointing out. I didn't realize that it was not showing the right screen probably. But thanks for pointing it out. And so just trying to build on the points I was mentioning about the guiding principles, that the strategy is an inclusive and way forward thinking, continuing what is happening. It's not a new thing. It's just taking what is existing happening in different countries and then taking it to the next level. There are 4 strategic objectives to the global strategy. And these are the key areas of work that we're working on. And Dr. Ajit, please do stop me if there's something wrong in the slides at any stage. So I'll keep going in the meantime. The first strategic objective focuses on global collaboration. And these are the basis of all the enabling capacities that we're looking at creating together with everyone. The first one is global collaboration and knowledge of transfer for digital health. And this is extremely critical. Without collaboration and without being able to share knowledge, we cannot leapfrog and benefit from the digital health perspective. Hence, the first focus is on SO1, which is on global strategy, on global collaboration and knowledge transfer. Second one focuses on implementation at the country level, at the ground level, which is also extremely important given the historical perspective we've seen in terms of digital health, where we have struggled in scaling and institutionalizing digital health. Third one is governance. And again, one of the factors of a sustainable ecosystem for digital health will be a strong governance, whether it's owned by the ministries of health, whether it's owned by the ministries of telecommunications, whether it's jointly owned by them, or whether it's owned by a stakeholders group. I think the governance, having a sustained governance structure is critical. And the fourth one is people-centered health systems. Historically, this is the first time we have an opportunity where technology is touching directly the individuals. And that's where we have the capacity and the opportunity to provide these people-centered healthcare systems using technology. And that's why I think the focus of these 4 strategy objectives is listed. I'll go a bit of details into these SOs. And then on the chat, I'll put a link to all the global strategy. The global strategy, for those who are in the digital health space, I think is an important document to be aware of. Because as I said, the first one is around global collaboration. We don't want people doing different things parallelly. Let's come together. It's not a WHO strategy. It's not a member states only strategy. If you look at the global strategy, it actually talks of specific actions. There are 172 actions which are listed for short term, medium term, and long term. And each of these actions are distributed for member states, for WHO, and for partners. So we want to work really collaboratively. And these are some examples here I put out for the first strategic objective of what areas and how this will function, what will be the actions carried out. There are networks and partnerships which are already functioning. We want to leverage these across the board and make these official sort of in terms of implementation. There are policy dialogues, research, bringing the research together. There's been a lot of resources which have been spent on research of digital health, and we want to harmonize those research resources as well. In terms of SO2, the implementation part, which I mentioned, it is about building sustainable architectural blueprints and also helping countries implement it, but then implement in a way where they can assess the impact and iterate it on a long-term basis. It targets healthcare workers, frontline responders, policymakers as a whole to be equipped with tools and solutions and capacities to be able to implement the healthcare services in general. As I said, digital health is an enabler in the first phase. Governance issue has been a critical one, and I think one of the most weakest areas of work until now, and that's why a lot of flesh and blood has to be put into governance. And this includes data securities, this includes regulatory frameworks, the policies. These are the systems which will enable digital health to be delivered on the ground and able to sustain it, because we can have short-term projects, which has been a long time. And I'm being very critical of digital health myself here, but to be able to have this as an ecosystem change, a switch of how we deliver healthcare services, a robust governance has to be in play. And what is very fortunate, as Marcelo mentioned, the political push right from the UNGA to the member states in all the assemblies, in all the regional committee meetings, we're seeing a lot of countries coming and asking for this kind of technical support to be able to establish that governance structures, to establish the regulatory frameworks. And I think that's very promising in terms of how digital health is taking the next stage going forward. And as I alluded to earlier a little bit, people-centered health systems, we're changing this approach. I mean, it has been unique in the way that we can now reach out to individuals. Recently, McKinsey report presented that we have about the prediction of by 2023, about 21 trillion sensors will be out in the world, which means every individual will be somehow getting connected to 3 sensors in his library daily living. There is an opportunity. Of course, there is a very strong need for regulations of that work, but there's an opportunity to be able to provide that healthcare service adapted. The quantum computing, we have practices coming up in there, but also let's not forget, people-centered care is also as good as for SMS services even today. We are seeing programs in rural Africa where SMS-based programs are helping change the healthcare delivery systems, especially in terms of COVID. It was very relevant, but also before that, whether it's chronic conditions like diabetes or hypertension, digital health programs are helping. We need to institutionalize this to be able to make that longer-term healthcare benefit for these users. This is a very important part, and I'm putting this slide out here because when the strategy was created, one of the major issues that was identified was the distributed funding, where every donor with their priorities, every country with their own priorities, was trying to create an investment for the digital space, which led to a lot of distributed and utilized sort of a vertical systems where funds were duplicated for the same areas of work. And I think that's why one of the big push of the digital strategy is to come together and reinvest into, not recreate the wheel, but try to use the same sort of learn from each other through the SO1 as mentioned, and make that opportunity so that every country can leapfrog the technology and benefit from most. And we've seen some great models of this in digital banking, where countries like Nigeria and Kenya have provided solutions which have been used by developed worlds as well. And so I think that's a big technological benefit that can be leveraged, and we need to bring that into our digital health thinking. And I think it's not a one-person hat. that this is how it can be done. It has to become for everyone to come together. Anyone who's investing in working on digital health needs to try and attach itself to the global strategy and see how those actions are being serviced through their investments. That was about the global strategy which was approved. Of course, there is a roadmap and an action plan which has been developed. And this is an action plan for WHO country officers, for member states, for all partners that we are engaging with, to be able to commit to the global strategy, to catalyze and maximize the impact of tools and benefits, and to make it sustainable by measuring and iterating it. So that's a standard action implementation cycle that has been presented. There's a framework that is out there, and I won't go into too much details on this framework as can get very technical, but the point again is we are working towards a dynamic maturity model where countries will know how to improvise themselves and work towards a better healthcare ecosystem using digital health. There is a roadmap which is in play. We are working, every country is putting this roadmap together. And one of the differences that we have had in the past is countries, after creating global strategies, started creating their own national strategies. And what this global strategy was intended to do was, and has done, is this is a strategy for all the countries. We don't need to recreate strategies for every country at the ground level. What you need to do is create a roadmap for implementation of this strategy. So take actions. The actions instead, this is your country strategy, they have endorsed it. So we need to take the actions, look at where you stand, and based on that, create an implementation life cycle for the different iterations that will happen. In the step one, we're not telling countries to start fresh. It's a lot of work has been done in digital health. Let's just synthesize that together as one way of bringing together what has been happening so that we can help synthesize the existing ecosystems, existing initiatives through the different lenses. There are some countries which are much advanced in interoperability, some countries which are looking at equity, some in terms of governance. Let's look at what priorities the countries has, map these to the different partners and stakeholders as to who has been able to deliver that, and the capabilities and core competencies of how to deliver on these different initiatives and actions. And then finally prepare we're helping countries to prioritize this based on impact. Because again, as we said in the past, it has been very verticalized and individualized to the donor areas. It's high time that we come and see where's the maximum impact for digital health and how can we deliver on that maximum impact together as one. This is just an action plan example that is being worked on by countries to implement. So we have agreed on multi-stakeholder action plan as available for countries on each of the initiatives that's happening. And then finally, as I mentioned, the iterative model is step 2, which is the implementation cycle, to make sure that we are not doing it as a project, but as a sustained program so that you get to the best of it all throughout. WHO will have a shared space for all countries, which will be launching soon, which will have all these knowledge and tools, the different SOs, that will have different products available there through this dashboard, where you can look at existing programs from lessons learned from countries, what are the knowledge products, and use them at your own country level by adapting it through technical support. So the global strategy is really focused on trying to deliver to 2023 different areas of work stream. And this is just some examples of the actions listed, where you can see details about how it's being implemented and how it's benefiting in that space. One of the specific examples I want to give here as my last couple of slides is how we are together as a multi-stakeholder coming and helping. So WHO with ITU, which is a UN agency for telecommunications, has been working on creating benchmarking frameworks for AI for the last 3 years. And this benchmarking is already forward thinking in terms of providing guidance to countries about machine learning algorithms, about maximizing impact of public health through the quantum computing tools, providing regulations for this area of work already. Ethical guidance, which was just recently released by WHO, is already being implemented at countries for different projects. And we are seeing the impact already. For example, there's a huge potential of AI in cervical cancer, which is coming out, in TB screening, in diabetic retinopathy, which are already evidence-based and are showing that the cost of digital health delivery can go down massively. In rural Africa itself, we've seen cervical cancer treatments screen and treat options, which are costing $100 per patient right now, with AI regulated and ethically approved products can go down as under as $1. And I think that's a major shift in how digital health will change the way health delivery is happening at the ground level. There's a lot of evidence coming around this, and I'm happy to talk about it in details, but I wanted to touch on this point. And also mention that there's huge potential. So it's not a one-off WHO or ITU thing. There are huge stakeholders who are involved. And my final call and message, this is a sort of prototype of what the framework will look at. But just to mention that without going too much details of the AI for health, today's digital health is tomorrow's health, as I've always said. So we need to work together on this space. So please do come and join in. And that's what the focus has to be. It's about collaborating and working together. Marcelo has already shown some great work that is happening in the region, working together. I think that has to be the model for everyone. With that, I'll end my talk. Thank you, Dr. Najib, for giving this opportunity. And I hope I'm not bored with a lot of theoretical display here, but which is not like me. I'm a very practical person, but I think this is important for the different stakeholders of digital health to understand the basis of how to be able to deliver towards a cause going forward. Thank you, and back to you.
Thank you. Thank you very much indeed, Samir. This is fantastic. And as has been said, it's about collaboration and it's about networking and it's about actually acting as one and facing the problems that we face as united as possible. My third speaker on this panel is Dr. Mordrek Chipi. As I mentioned, he is from South Africa originally, and currently, of course, he is the Regional Innovation Advisor of the World Health Organization Regional Office for Africa in Congo, in Brazzaville. I did mention his previous commitments and work and all that, but the more important thing is that he is actually committed to the innovation and to public health and to working together. Without any further ado, I would like to invite Dr. Chipi to present the work of the regional office in the African region in particular, maybe a reflection of what they are doing to translate the global strategy into a regional one and then at the country level. So the floor is yours, Dr. Chipi.
Thank you very much. I don't know whether you can see my slides.
Yes, indeed. Yes, indeed. Yes, indeed.
Yes,
the only thing is just to show it as slideshow so that we can see the full thing. Go ahead.
I'm trying to do that, and I guess we are going to face this. So if I do this, is it any better?
No, this is much better. This is fantastic. Go ahead.
Great. Thank you very much. Yeah, I can only thank you for inviting me to this interesting discussion. And as you can see, innovation is also something that is at the core of our work. And when you were announcing the winners of the papers, I was actually smiling all the way. This is what we try to encourage from our region. To foster that spirit of creativity as well as ingenuity. And through our regional director, Dr. Moeti, she is very much committed to seeing solutions emerging from the continent, also being not only of relevant to the continent, but serving the global audience as well. So I'm going to drift a little bit just to spice the conversation, because I knew my dear brother Marcel was going to talk about some of the regional perspective with respect to digital health, and also my brother Samir was also going to touch on the global strategy for digital health. So I thought maybe from a regional perspective, let me also bring in with some practicalities in terms of what are we exactly also doing, how are we harnessing some of these digital solutions and this stuff. So I thought maybe let me present to you our work, especially on our strategy in terms of fostering development and scaling of some of these digital innovations for sustainable impact. So this is basically our thinking and the way we are structured, because we know the needs are very much high on this part of the continent, but we want to try and identify and foster development of some of the needs-driven innovation, the digital solution. And of course, catalyze scaling up of these innovations and also digital solutions. And also how can we help to communicate success of some of these digital solutions that are emerging from the continent that can also be applied globally. So with the first stream, what we have been preoccupied with, especially in the context of COVID-19, and the way we are reorganizing ourselves here in WHO in the African region, and as you rightly referred to my short bio, that part of my work is also to try and drive the transformation agenda in the region. So basically instilling new ways of doing things. So the way we are now organized is we don't want to be an organization that is lagging behind when it comes to cutting edge technologies, cutting edge science, cutting edge innovation, but to help even the way we structure our program to be ahead of the curve. And we've been doing this through scanning of the horizon for emerging technologies and digital solutions with potential impact, not only for Africa, but also globally. And we try to do this because we know the priority needs of our continent, and to shape the innovation agenda and by either organizing innovation challenges or hackathons, or even working closely with other different players to try and influence channeling of their resources towards certain innovations and digital solutions that we know can really bridge the gap that we are seeing on the continent. And like what Samir was saying, we also try to foster that collaboration in the innovation space, and also tapping into the mature pipeline of either digital solutions or innovation pipeline. And what we have been recently doing is to really work with countries for them to be in a position to articulate demand for either digital solutions or innovation, and we call for an open innovation to seek those solutions from the global market. And we've been recently working with Zimbabwe and also in collaboration with China Academy for ICT. So this is in a way of trying to match demand and supply. Some of the activities in terms of trying to surface some of the breakthrough innovations through organizing webinars and also conferences, and combining some of these innovative best practices that are emerging from our continent through different mechanisms. One of the interesting bits of what that we've been doing, like I said, what we try to help different program areas, and this idea actually emerged from the COVID-19, where when we scanned the global horizon, we realized that there are so many countries that came up with very, very practical, innovative solutions that augmented or complemented the way COVID-19 was tackled in different parts of the world. And we wanted to surface all these emerging digital solutions or technologies and present some of these innovations to our African countries, maybe to apply frugal thinking, or even to try and see if they can adapt some of those technologies depending on the context. But we realized that countries were very much interested in this area of work. And we are now shifting our focus to try and strengthen different program areas and help them to scan the horizon and help them to also ask relevant questions. What is new in their area of work? how are they leveraging digital innovations or emerging technologies, and we've been seeing different program areas actually very much responsive to this line of work, and we realize that this can also catalyze or facilitate, strategic dialogue with different countries and preparing countries for what's coming and what can they organize them, how can they organize themselves better, either from a regulatory point of view, from an ethical point of view, and from a policy point of view, because what we've seen also our countries, they react quite late, but as you know, technology it's advancing quite fast. And these are some of the areas that I thought I can just share with you how we are doing in different areas. And for vaccine delivery, especially for COVID-19, this is exactly what we also did. We tried to map in terms of the value chain. If you look at the value chain of vaccine delivery, how can we start, incorporating, integrating, and taking advantage of emerging technologies, either GIS-based tools, real-time monitoring tools? How can you also do micro-planning and all that? And this is what we've been really busy helping countries with. And when on the front of scaling up of health innovations, we have realized that as the regional office, as WHO General, we do interface directly with different governments at the highest level, and so we can influence, uptake of some of the digital solutions and innovation that can show immediate impact. And the other thing is also to help countries capacitate their own mechanism in terms of managing their own innovation ecosystem, so that they can be able to harness some of those digital solutions and also being able to scale. So we are working with different countries. I've just mentioned Uganda and Botswana, and we are also trying to build capacity in terms of offering courses like innovation leadership, so that at the highest level, they know that what is it to create an enabling environment that can really see some of these innovations being scaled up, some of the digital solutions being scaled up. So what we have done, maybe you've read from my profile, we did an innovation challenge in 2018. And some of those innovations, when we tracked them, we realized that they have an amazing story of success in terms of scaling, not only from their countries of origin, but also across other countries and even globally. And this is some of the work that we are actually now helping countries to really make sure that all these breakthrough innovation digital solutions really end up making a difference in people's lives. And this is just an example of the work that we are doing with Uganda. How are we? It's very much in response to what we call the regional strategy for scaling up health innovations in the African region that was adopted by all our regional member states. So when we received the request to support, say, Uganda to strengthen its innovation ecosystem, basically the idea was to, within the Ministry of Health, you can set up what you call health innovation cluster. So this is a way of unlocking demand, creating demand for all for the impactful innovations that are emerging from different sources, either from universities, either from funders, either from local entrepreneurs. But how can they come up with a mechanism that can really capitalize on some of these innovations, and also these innovations responding to their priority needs? And the same applies to Botswana. We're coming up with an e-health integrated platform that can play the same role, but very much from a digital perspective. How can you also help the government to articulate the demand for digital solutions, innovations, and also activate a network of partners that can support scaling and, of course, go through monitoring and evaluation. And we know that when an innovation on a digital solution has begun to show impact, that can also result in it being mainstreamed into the broader health system space. So these are some of the areas that we are actually helping countries to try and see if they can leverage some of these digital solutions. And another interesting part of the work is to try and pitch the return on investment for setting or strengthening innovation ecosystem at country level. And so we are also receiving requests from different countries because they want to use an investment case, to unlock some of the funding either from the government or from other partners. And we've been doing this with Niger, where we actually developed a robust investment case because they wanted to set up an innovation hub that will also see their local ecosystem, their youthful population, coming up with some of those creative solutions, and not only to save the ecosystem of Niger, but also, that can be applied across the whole continent. In terms of practical solutions, especially in the context of COVID-19, we've been helping countries a lot in terms of helping them deploy some of the tools that they can use for COVID-19. And this is just a specific example for South Sudan and Lesotho, where we help them to deploy a self-assessment screening tool for COVID-19. And this also tool has been adapted for COVID-19 vaccine delivery. And these are some of the initiatives that we see countries have got the taste and zest for practical solutions that can offer immediate impact and also that can be sustainable depending on how the innovation or digital solution has been contextualized at local level. And this is also another example which we also scaled up in the context of COVID-19, where we realized that there was a lot of corruption when it comes to COVID-19 certificates. So one young man from Zimbabwe came up with an anti-counterfeit innovation to combat, this fake COVID-19 certificate, and it has been scaled up in Zimbabwe. Now it has been mainstreamed within the Africa Center for Disease Control initiative called Trusted Travel, and we are proud that some of these interesting or emerging technologies or emerging innovations that is WHO in the African region, we've identified, we've actually walked through in terms of their scaling. They are now being mainstreamed from a continental body. So another thing, remember I told you 3 streams of work, which is one to foster development of those innovations and one which is to do with scaling. But what we're also trying to do is to communicate, success of some of those successful innovations that have been either scaled in one country. And we have one of the things that we have tried to do is to establish a robust and dynamic innovation marketplace. And this marketplace, I'll show you more of it in a second. What we have realized is how can we match the demand of some of the digital solutions or innovations to the supply? How can, matching supply and demand, and also making sure that there are interested partners that can support, either deployment or adoption of some of these innovations. And this marketplace has really become so popular on our region. And as I was checking, it surpassed about 2 million subscriptions, which means it's heavily trafficked by different people, either at government level, either at innovators level or funders level. So this is something that we take pride. And monthly, we try to also release a monthly publication that can communicate to either internal or external stakeholders to highlight some of the success stories and ongoing projects that we are embarking on. And another thing that is worth to mention is, as WHO, we are a co-convener of the UNDS, what we call OIBC, is a regional coordination platform. So all the regional UN agencies came together as a way of trying to find strategic areas where they can accelerate achievement of SDGs. And one area which came out strongly is to support leveraging of emerging technologies and digital solutions for inclusive growth and development. And I'm actually chairing this group with different UN agencies. And we have used this as a platform, not only to communicate WHO work, but also to communicate broadly what UN's contribution when it comes to digital transformation and also harmonizing our approach in digitization front. Yes, we have been very active in different events like this one. So that's why I'm very, very happy that I'm invited to be part of this conference, because this, in a way, we have realized is very important to communicate some of the work that we are doing on this front. So this is just to say we have churned out a number of products. And what we have been talking to or referring to, we've created a compendium of innovation in digital solutions that were used for COVID-19 in different countries, so that there is cross-learning. And we've also done the same for COVID-19. We've done the same for harnessing technological innovation for COVID-19 vaccine delivery, and also coming up with some of these investment cases for countries. And a number of publications are very much on the pipeline. Like I said, we are now targeting different program areas. And what the idea is to come up with a compelling report that looks ahead in terms of what is it that is emerging from the horizon that program areas and countries should now start, thinking around, and also not only to know, but to try and make some adjustment either internally on how they can accelerate either adoption of some of those emerging technology, for instance, artificial intelligence. So this, we find that this is a piece of work that is very, very important. And this is just the platform that I was telling you. And so now the traffic for this month was around 2 million. And we are also receiving different information from different people that are using the platform. And most of the messaging around that is to encourage us and also to acknowledge the strategic nature of coming up with such a platform that the whole region can refer to and also know what is happening. So I was trying to go fast. I thought maybe let me just touch on this area and make you aware of some of these specific issues that we are currently focused on as African, as WHO in the African region. Over to you. Thank you so much for this opportunity.
Great, thank you very much indeed, Dr. Chibi. This is fantastic, and we are aware of the value that you are adding to the regional office's work and the innovation that you are leading and the under the management of the regional office. And we know that Africa in particular is facing lots of challenges, including its infrastructure, education, health problems, and all that. So the task is not a small one, but I'm sure that with the work of other people in the regional office and beyond, and WHO and other regions, I'm sure you will be able to overcome many of these challenges and succeed. And we wish you the best, actually. Now we have about 12 minutes to, if you have questions, if you have anything that you would like to pose for the three speakers. And I have in the question and answer session under that icon, Rito Sholi asks, if I may ask, how do you approach the question of privacy concerns? In Germany, this is a big concern, meaning the conflict between people's rights to privacy and the need for data for research. I will ask the three of you to address this maybe in 1 or 2 minutes each. How do you deal with the issue of privacy in the American region and at the global level and in the African region as well? So I will ask each of the speakers to make his sort of intervention on that. Marcelo.
Thank you very much, Najib, and congratulations also to Modric and Samir. Very happy to share this panel with both of you. Well, this is the $1 billion question because this is it's not a new problem. It's a constant situation. And in particular now, our approach, I will summarize in two main concepts. What we are doing is we are taking a real and for once multi-stakeholder and multidisciplinary approach, reviewing what is already there that was prepared before the pandemic and before this acceleration of new technologies. When you look at the Freedom of Information Act or the different kinds of names in the countries of the Americas, they are law very robust that all of them were developed more than 20 years ago. This is something that we need to review. But if we don't do that in a multi-stakeholder and interdisciplinary approach, that will be a situation because we need to have different people, different views, different professions. So this is the time for that particular approach. And this is what we are doing. We already had 3 sessions with legislators, congresses from all the Americas to discuss that particular situation, but also with a lot of level of specifications, because we cannot have that discussion on isolation on medical records. So we developed some analysis on looking at telemedicine, looking at medical records, looking at research, looking at policy making. So with that in mind, then we will need the next phase is to work with experts on drafting what are the elements that are needed to update what we have or to draft some new instrument. I will stop here. Thank you.
Thank you, Marcelo. Samir, at the global level, are you addressing? I know that one of the concerns in the global strategy is addressing the privacy and how it is dealt in different countries. Samir.
Rajiv, thank you so much. For the question, and again, as Marcelo mentioned, it's $1 billion question. Just to give a caveat, remember the first part is data. It's extremely important to be able to move and make leap forwards. In particle physics, where we have so much progress in the development of technology, about 90% of the data is in open source setting, is available for research. In health, we are down to about 18%. There's a huge gap. So obviously, there's a big need for data availability. Now, that's where the privacy, and it's of course difficult. Particle physics versus health data is very different and difficult in health systems. But at the same time, it's crucial. So that's one part of it. How do we manage privacy? So there have been discussions, as Marcelo mentioned, it has to come from the ground up. The first philosophy stands that data belongs to the individuals. But how do we work with the private sector in this play? A lot of it to make sure that this data is available, especially in AI also as we're going forward. The biggest challenge we're seeing is to validate these algorithms. We have to have unbiased data sets. And so the privacy, one of the discussions in the global strategy is trying to create a regulatory instrument that can allow countries to have these data sharing, at least for healthcare purposes. Of course, as mentioned by Marcelo, global, there's only one possibility when all the countries come together and form a consistent instrument. It may be time to discuss whether we need a regulatory framework or a legislative. There have been discussions about having something which has like a treaty also that can help and make sure that we can move forward with this thing. But these are still ongoing discussions. We need a lot of action to make that happen. I think some of the discussions came out at the recently held Global Data Governance Forum as well. So I think there is action towards that. But again, it has to be everyone's action. Over.
Thank you. Thank you very much indeed for your insight. Dr. Chippy?
Yeah, I think what Samir said, I guess I don't need to repeat it. I think he was spot on. But as you can imagine from our region, it's data protection and protection of privacy. It's from a legislative side, it's quite weak, and we normally refer to that as a blessing in disguise. I remember talking to a German colleague actually to say that has also made it easy to leapfrog some of the breakthrough innovation because of this weak regulatory environment. But not to say it's good, but it's sometimes it facilitates certain things. But like what Samira is doing, I think we are working globally to really address and also support countries to strengthen the data privacy and protection.
Excellent. Thank you very much. And my own experience is that privacy has two facets to deal with. One is the ethical part, and the other one is the legal part. And when we strengthen the legal framework in countries, we can actually aim at protecting privacy, especially if we believe data is the new wealth, is the new currency, and the health of people is dependent on data, and data needs to be protected. It needs to be respected, its privacy and confidentiality and all that. So thank you very much indeed for your insights. And I think we have a lot of work to do in countries in terms of protecting the privacy of health data, in particular through legislative frameworks and through better awareness and better education for people to be aware of what can be done to protect the privacy of the individuals. I have another question actually, which came on the question and answer. I know it's not the forum right now to discuss that, because there will be a panel discussion on standards. But if we can mention what are the different standards for different things that are followed. So I will start with Dr. Chipi. If you are promoting, if you are working on the standardization to allow and to promote interoperability between countries and between systems in the African region, and then we move to the other colleagues. Dr. Chipi.
Yeah, certainly. So with respect, for instance, so with the global strategy for digital health, we also developed an implementation framework. I think Dr. Samia is very much aware of that, which was adopted by our regional member states. And one of the key areas that was to be addressed in that is interoperability and also standards to be taken into consideration in pushing the digital health agenda. So it's a priority for member states, and as WHO, we are just there to support implementation of some of those issues. So I know my waving response to this is it's a priority for member states, and they need our support.
It's a priority. Yes, it's a big challenge, and it's a priority for those who are taking care of the health systems development and digital health. Samir, what is your go on that?
I think that's another $1 billion question about the interoperability section. It's been there since I've started working on digital health, and it continues to be the same sort of question marks zone. I think there's a lot of interoperability that happens, yes, of course. And the question is, with the change in technology, the change in governance, of course, it's critical. It's important to have, but we have seen a lot of this work already ongoing, happening. So the one message I give out to member states is, don't recreate the wheel. Don't try to look at what has to go. Look at the problem statement. Interoperability is not the problem. It's what you need. Technology can always be addressed today and tomorrow as well. And technology is changing. So of course, there's a strong need for standards. There's a strong need for adherence to these standards. And that's where the developmental agenda comes into play, the development technology comes into play. Our focus should be on the problem solving and trying to address that. The technology is the peripheral part, is the enabler. And I think a lot of times we get boggled down by the enabling capacities. So I think the question will continue. I don't see a solution in sight for interoperability. And I think it's just trying to play it by the ear. And again, maybe I'm a pessimist on this topic. somehow, but I think we should not let the interoperability challenges take over the capacity that digital health provides in terms of enabling healthcare services. And we work with what we have in that space of moving forward, being agnostic to such challenges. And that's just a thought process. I think maybe I'm hoping by the time I retire from my life, I will have a solution to this one, which is concrete. Let's see.
Thank you. Thank you very much indeed, Samir. Yes, in 2013, I think, and 2011, before that, we did organize the Global Forum on Standardization and Interoperability, and during that in Geneva. And then all the standard setting organizations were around the table, and the challenges were identified, starting with the prices and the translation and the capacity. So there are many challenges, but without standards, we cannot do much actually to proceed with the great ideas that we have in electronic health records or health information systems or else. What is your take on that, Marcelo?
Well, in addition to everything that was said, that I agree, I think that I do believe that we need to work, and we are doing that. We are producing a technical document related to, it's a knowledge capsule, because a lot of people are talking about that. Plenty of people say, we will use HL7, or it's very easy to say. It is not so easy to implement, and it's very well understood by some people, but not by the one that need to take the final decisions. But this is the first time that we, for example, need to be clear that in addition to the, let's say, the traditional ones, HL7, FHIR, DCOM, etc., we have ICD-11, that this is the first time that can be fully integrated, but also looking at a more holistic approach, and in particular looking at data management, infodemic management, and also we need also to incorporate other kind of standards. For example, the one that are used to classify scientific information, the one that are for IT platforms, the new standards that were released for artificial intelligence, more and more. And for example, we discussed the issue of cybersecurity and confidentiality. We need to be clear about the standard for digital signature. So we need to have a more holistic approach, but also we need to develop some kind of awareness that what are we talking about now when we talk about standards. This is our approach at this point.
Excellent, thank you very much, Marcelo, and thank you for all. I have a question. I will not ask for any answer, just to refer Ursula, who is a great colleague of us actually, to yesterday's talk by Alan Labrick, in which he did talk about maternal and child health and the use of mHealth to support the child and maternal health in different countries. So I do trust, and I think it is already available in the and as part of the recording of the sessions, which is open for everybody. So I would like to thank Marcelo and for the fantastic presentation that he made about the Latin American and the PAHO work on this particular area, and my colleague, my friend, Mr. Samir Bajero, for the excellent presentation on global digital health strategy, and of course my new friend, Dr. Chipi, for the presentation and for innovation that he is leading in the African region. The only thing for me to say is thank you so much for the audience and for everybody. And I would like to ask for the next presentation, for the next panel to convene and to be moderated by Dr. Scott. So it's in your platform, Dr. Scott. Thank you so much, and I look forward to learning from the colleagues. Thank you very much. Thank you.
Thank you, and we'll